What if I told you the pill you take every single day, the one for your allergies, your sleep, maybe even your bladder, could be silently paving the way to dementia? It sounds alarming, almost unbelievable, but the scientific evidence is mounting. Stay with me for the next few minutes, because uncovering this shocking link could be the most important thing you do for your brain health today. Do you ever have those moments? Forgetting where you put your keys, struggling to recall a familiar name, feeling that frustrating brain fog more often? We often brush it off. Oh, I'm just getting older. But deep down, there might be a nagging worry, a fear about what these lapses could truly mean. Dementia, Alzheimer's. These are words that strike fear into many of us, representing a loss of self, a loss of connection, a future we desperately want to avoid. They tell us dementia is often genetic or linked to lifestyle. And while those factors are incredibly important, there's a crucial piece of the puzzle often overlooked, hiding in plain sight in millions of medicine cabinets: common medications. Today, we're pulling back the curtain on this unsettling connection. We're going beyond the usual advice and looking at specific drugs, some available right over the counter, that research now strongly suggests could significantly increase your risk of cognitive decline and dementia down the warned road. This isn't about fear-mongering. It's about giving you the knowledge you need to protect yourself. So, where does this alarming link come from? One of the biggest groups of medications under scrutiny is called anticholinergics. Now, that sounds technical, but stick with me. These drugs are incredibly common. Think about older antihistamines like diphenhydramine. Think about certain medications for overactive bladder, some older antidepressants, drugs for vertigo or motion sickness, muscle relaxants, even some Parkinson's treatments. Millions are taking these regularly. How do they work? Anticholinergics block the action of acetylcholine. Imagine acetylcholine as a vital messenger chemical in your brain, like the Wi-Fi signal connecting different parts of your neural network. It plays a critical role, especially in areas responsible for learning and memory. Now, picture these anticholinergic drugs coming in and jamming that Wi-Fi signal. In the short term, this signal disruption can cause side effects we might recognize: dry mouth, blurred vision, constipation, drowsiness, maybe even some temporary confusion. But what happens when that signal is consistently jammed, day after day, year after year? The research is deeply concerning. Multiple large-scale studies, published in respected journals like JAMA Internal Medicine, have followed thousands of people over many years. The findings? A consistent, dose-dependent link. The more anticholinergic medication people took, and the longer they took it, the higher their risk of developing dementia, including Alzheimer's disease. Some studies suggest the risk could increase by as much as 30% or even 50% with long-term high-dose use compared to non-users. This isn't a minor side effect. It's a potential catalyst for irreversible brain decline. What makes this even trickier is the cumulative effect, often called the anticholinergic burden. Many older adults, especially, are taking multiple medications for various conditions. You might be taking one drug for allergies, another for bladder issues, maybe something to help you sleep, and each of these could have anticholinergic properties. The burden adds up. It's like having multiple devices trying to jam that brain Wi-Fi signal simultaneously. Even low doses from several different drugs can combine to create a significant overall impact, an impact your doctor might not even be fully aware of unless they meticulously review everything you're taking, including over-the-counter products. So, how do you know if you're affected beyond the obvious dry mouth or drowsiness? The long-term signs can be subtle, easily mistaken for normal aging. Are you finding it harder to concentrate than you used to? Do words seem to be on the tip of your tongue more often? Are you misplacing things frequently? Feeling mentally slower or foggy? While these can be part of aging, if you're taking anticholinergic medications, they could also be early warning signs that your brain chemistry is being affected. Don't ignore these signals. But the story doesn't end with anticholinergics. Other common medication classes are also raising red flags. Let's talk about benzodiazepines. These are powerful sedatives like diazepam, lorazepam, and alprazolam, often prescribed for anxiety, panic disorders, and sometimes sleep. While effective short-term, long-term use, especially in older adults, has been linked in several observational studies to an increased risk of developing dementia later in life. The exact how is still being researched, but it's thought they might disrupt other crucial brain communication pathways or even cause subtle damage over time, particularly in memory centers like the hippocampus. If you rely on these medications daily, it's a serious conversation worth having with your doctor about the long-term plan and potential alternatives. And what about the newer sleep medications, the so-called Z drugs, like zolpidem, zaleplon, and esopiclone? They were initially marketed as safer alternatives to benzodiazepines. However, recent evidence is starting to cast doubt. Some studies suggest a possible link between long-term Z-drug use and cognitive issues, though the evidence isn't as strong yet as for anticholinergics or benzodiazepines. Furthermore, these drugs are known to increase the risk of falls and confusion, especially in the elderly, which can indirectly lead to head injuries and cognitive problems. Relying on a pill for sleep often masks underlying issues that could be addressed more safely and effectively through lifestyle changes or therapies like cognitive behavioral therapy for insomnia, CBTI. This information is so important, and many people are simply unaware of these potential risks. If you're finding this valuable, could you do a small favor and hit that share button right now? Sharing this video could genuinely help someone you know review their medications and protect their future brain health. Thank you for helping spread awareness. Now, a word about statins. These cholesterol-lowering drugs are lifesavers for preventing heart attacks and strokes, used by tens of millions. The link with cognition here is complicated and highly debated. Some patients report experiencing memory problems or brain fog while taking them. However, large clinical trials generally haven't confirmed a significant increased risk of dementia, and some research even suggests statins might be protective due to their benefits for vascular health, which is crucial for brain health. So, what's the takeaway? If you're taking a statin and feel you're having cognitive side effects, absolutely discuss it with your doctor. They might adjust the dose or try a different type. But never stop taking your statin on your own based on fears about memory. The cardiovascular benefits are overwhelmingly proven for most people who need them. Briefly, other medications occasionally mentioned in relation to cognitive concerns include long-term use of strong opioid painkillers, certain older anti-seizure drugs, and even some types of blood pressure medications. However, the evidence here is often mixed or less conclusive, and the benefits of these drugs for their primary conditions usually far outweigh the potential cognitive risks. The focus really remains strongest on those anticholinergics and long-term benzodiazepine use. Okay, hearing all this might feel overwhelming, maybe even a little scary, but the purpose isn't to cause panic, it's to empower you with knowledge. So, what are the practical steps you can take, starting today? First, and most importantly, do not stop taking any prescribed medication abruptly or without medical guidance. That can be incredibly dangerous. Instead, become an active partner in your healthcare. Schedule a dedicated appointment with your doctor or pharmacist, specifically to review your medications. Action Step 1. The Medication Review. Bring a list of everything you take: prescriptions, over-the-counter drugs, vitamins, supplements. Ask your doctor directly, do any of my medications have anticholinergic effects? Are there potential cognitive risks associated with my long-term use of specific drug, for example, benzodiazepine? Are all these medications still necessary? Are there safer alternatives we could consider? Sometimes, simply deprescribing, carefully stopping medications that are no longer providing significant benefit, can make a huge difference. Be persistent, be informed, and advocate for your brain health. Action Step 2. Prioritize non-drug approaches. For many conditions where these risky drugs are prescribed, like occasional sleeplessness, mild anxiety, allergies, even bladder leakage, there are often highly effective non-drug strategies. Explore options like lifestyle changes, better sleep hygiene, stress management techniques, meditation, deep breathing, dietary adjustments, regular exercise, therapies. Cognitive behavioral therapy, CBT, is incredibly effective for insomnia and anxiety. Physical therapy can work wonders for pain and incontinence. Talk to your doctor about referrals. Action Step 3. Build a resilient brain. Think of your brain like a muscle. The healthier and more resilient it is overall, the better it can withstand potential challenges, including medication side effects. Focus on the pillars of brain health. Eat brain-boosting foods. Load up on leafy greens, colorful vegetables, berries, fatty fish like salmon, nuts, seeds, and whole grains. Limit sugar, processed foods, and unhealthy fats. Visual. Colorful platter of these foods. Move your body. Aim for at least 150 minutes of moderate intensity aerobic exercise per week. Walking, swimming, dancing, whatever gets your heart rate up, improves blood flow to the brain. Visual. Active seniors walking or gardening. Prioritize sleep. Aim for 7 to 8 hours of quality sleep per night. During sleep, your brain clears out toxins, including proteins associated with Alzheimer's. Visual, peaceful sleeping person. Stay mentally engaged, challenge your brain regularly, learn a new language, take up a musical instrument, do puzzles, read widely, stay socially connected. Visual, person learning guitar, playing chess, manage cardiovascular health, high blood pressure, high cholesterol, diabetes, and smoking all damage blood vessels, including those supplying the brain. Keeping these under control is vital. Visual, blood pressure check, healthy heart graphic. You likely have your own strategies for staying sharp and healthy. What's one thing you do regularly to take care of your brain? Share your best tip in the comments below. Let's learn from each other and build a supportive community focused on healthy aging. All right, let's quickly recap the crucial takeaways from our discussion today. 1. Certain very common medications, particularly those with anticholinergic effects found in many allergy, sleep, bladder meds, and long-term benzodiazepine use for anxiety, sleep, show a significant link to increased dementia risk in scientific studies. 2. Other medications like Z-drugs and even statins warrant careful consideration and discussion with your doctor regarding potential cognitive effects, although evidence varies. 3. Never stop prescribed medication on your own. The most important step is to have a thorough medication review with your doctor or pharmacist, asking specific questions about cognitive risks and safer alternatives. 4. Prioritize non-drug approaches whenever possible for conditions like insomnia, anxiety, or allergies. 5. Proactively nurture your overall brain health through diet, exercise, sleep, mental stimulation, and managing cardiovascular risks. This builds resilience against multiple threats, including potential medication side effects. Understanding these potential medication risks isn't about creating fear, but about fostering awareness and empowering you to make informed decisions for your long-term well-being. Your brain is your most precious asset, responsible for your memories, your personality, your connection to the world. Protecting it requires vigilance, knowledge, and proactive communication with your healthcare team. You have the power to ask the right questions and make choices that support a sharp, vibrant mind for years to come. If you found this video insightful and want to stay informed on critical health topics like this, please consider subscribing to the channel and hitting the notification bell. Your support allows us to continue bringing this vital information to light. Thank you so much for watching. Take care of yourselves, take care of your brains, and I'll see you in the next video.